Welcome to NExTopia, Unraveling the Enigma, called National Exit Test for MBBS graduates. Let's embark this journey into the medical revolution called National Exit Test. Say farewell to multiple entrances like NEET, INICET, FMG entrance, and whatnot. As NExT emerges as the front runner and the new standard in medical education. It's a single exit exam and serves as an ultimate gateway for every single medical graduate in India. Guiding us through the intricacies and mysteries of National Exit Test is none other than our very own, the always charming Dr. Kishan Rao, sir, the founder of White Army, a trusted and knowledgeable source in medical education. With his expertise, we will delve into the heart of this challenging but enigmatic examination, uncovering its marks, pattern, and everything associated with it. Armed with these valuable insights, you can devise a study plan that will guarantee you the maximum success coming into the next exam pattern. Empowering you to conquer this academically challenging exam, but still, don't worry when Kishan Rao sir is with us. Thank you so much, Dr. Kishan sir, for taking time out of your busy schedule to guide and calm down us anxious aspirants of NEET, of next examination. I'm sorry that might happen a lot of times going forward in this session. The future awaits, and let's witness the dawn of a new era in medical education and navigate the uncharted territories with confidence and zeal with Dr. Kishan. Over to you, sir.
So, just like Shiva already mentioned, we cannot come over about whatever you already have. Change is always inevitable, my dear friends. In our life, every next step is a change and it's inevitable. We can either resist it or potentially get over by it. Or you can choose to cooperate with it and adapt to the new change and learn how to benefit from it. Look at the only optimistically and get benefited. When you embrace change, you will begin to see it as an opportunity for growth. So this again, we are going to a drastic change here from NEET PG or whatever the curriculum presently we are having to the next another revolution in the field of medical education, that is NExT. So we have to embark this. See, this is just like our university examination. I was telling to Shiva yesterday, we don't have any option but for to adapt with this. So don't have any negative thoughts or don't just heed into any rumors or negativity turning around. Just look into the positive aspects, because it has taken so many years to bring this process into practice, now implementation. So all the seniors must have thought a lot about this before implementing this. So don't think anything negatively. Instead, look into it as an opportunity for growth. So all great changes are preceded by chaos, just like what we're witnessing now. Take for an example, a few years back about GST implementation. Everything was a big chaos, right, Shiva? Yeah. Everyone, there was no clarity at all. What's happening? Even those who implemented only didn't know what is this all about. So there was a lot of chaos, commotion prevailing in the society. But now, do we even talk or think about GST? No,
absolutely not, sir.
It has become a way of life now. Okay, so similarly, the first step towards change is awareness. Yes, me and Shiva are right here to create an awareness among all the medical students out there to bring out what is a summary of entire NExT is all about. The second step, yes, definitely we can create the awareness. We can tell all about this. But if the main step is about the acceptance, yes, at this juncture, each and every medical student has to accept the what is the truth now, and we have to go with that. Are you ready, Shiva, to
yes, sir,
create the awareness and to make them accept this fact?
Yes, sir.
Yes,
absolutely.
Then that will lead to the success. Okay, that is a way ahead to success. So coming to the objective of NExT. Dear friends, as we all know, there is, yes, India is a it's a nation of diversity, all those things agreed. But when it comes to medical education, there is a lot of discrepancy. starting from a central institute to a state college, or from a college in Kerala to college in maybe in Delhi. There's a lot of discrepancy in the duration of the course or the pattern of teaching or maybe curriculum. Everything, there's a lot of difference. But to make it one as uniform, we have this. They have implemented this NExT exam. So main objective is to bring out uniformity in medical education throughout the nation. And to earlier in our times, I remember we had to write so many entrance exams. Going to that place, for example, we were traveling all the way to Chandigarh to write a PJ entrance examination. We had to go to Delhi or some other place to write a AIMS entrance examination, JIPMER and NIMHANS and Manipal, Vellore, all those things. That was cut down by NEET PG, and then they had INSCET. Now again, to cut short again, to make it more convenient, feasible for all the, in our time, we had to pay so much entrance exam fees also. For separate exams, we had to pay a lot. But now all those things have been cut down. Now to go another step ahead, they're making from 2 exams to 1 exam, from NEET PG and INSCET, and then one more that's called FMG exam. For 3-4 exams combined together, they're making it as 1. So it's again very student friendly and convenient for all the students. And of course, to avoid multiple entrance exams and raise the standard of graduates certified NMC. So we have different universities and different criteria for assessing the students. So to make it uniform altogether and to raise a minimum standard of training, they have brought this process of NExT examination. So the pattern of NExT exam will have mainly 2 steps. These are called steps. Step 1 is that's NExT 1. Then in this next second step, we have NExT 2. NExT 1 is going to be a purely online MCQ based test, in a computer based test, which will be conducted twice a year. Whereas NExT 2 will be this online, this will be conducted by, NExT 1 will be conducted by the NMC itself, by a official authority like AIMS. NExT 2 is an offline mode of examination, purely practically oriented, and 1 exam in a year with 1 supplementary followed by it. Okay, this will be conducted by your respective universities. So who are all eligible to take this NExT exam? All Indian medical graduates from colleges recognized by NMC or can attempt this NExT examination, and all foreign medical graduates can also attempt this NExT examination. In both the cases, students have to complete the MBBS that's final year, that is 3rd year part 2, or equivalent in case of foreign medical graduates. And this particular NExT examination is acts as an entrance exam also for starting the internship soon after the final year MBBS. And this same exam, this same MCQ based exam is a tool for PG seat also. So this is an entrance exam for internship as well as post graduation. That's NExT 1. Through NExT 2, this is a licentiate examination for getting into practice registration in India. So this acts as a 1 exam, 2 benefits. So coming into the details of NExT 1, this is a purely a MCQ based examination. Unlike we don't have any university that long essay theory exams anymore. Instead, it has been made into a MCQ based online CBT computer based test. It will be conducted twice a year, once in May session, another one examination in the month of November. And there will be totally 540 questions comprising of 6 papers. There will be 3 major papers and 3 minor papers. And each MCQ right answer will carry +1 marks, and there will be minus 0.25 for any wrong answer. Minimum 50% of the marks should be required to pass the examination. Remember, this is not percentile, unlike USMLE and all. This is purely percentage of marks, 50% of marks. That is 270 marks. Out of 540, you should minimum get 270. And this is a must. NExT 1 is a must to enter into internship. And there is no limit on number of attempts for NExT 1. Okay. and you can write n number of times. Yesterday, some student called me and asked, sir, now if I want to do my PG after 10 years, what to do? Okay, you can either keep on attempting or you can write even after 10 years also. But having said that, you should at least attempt once or complete should step 1 and step 2 within 10 years of starting MBBS course. That's once you should have completed within 10 years, but you are not willing to take up any PG course immediately. You want to take up after 15 years. Again, you have to write next one and get a good score to get into a PG post-graduation. So this course, once you have written exam, this course, whatever you get, that is valid for 3 years, or maybe 6 counseling sessions. This replaces the first final year university theory exams, like I already said, or no more that long essays, short essays, short answers, no more. It's in practice, we all replaced by a MCQ based test. So we have, like I mentioned, 3 major subjects and 3 minor subjects for next one. Major subjects include medicine and allied subjects, surgery and allied subject, and obstetrics and gynecology. Allied subject by means medicine. Along with that, we can have psychiatry and radiology, okay, and dermatology, and little bit of physiology as well. Allied means all the pre and paraclinicals also put together, relevant pre and paraclinical subjects put together. Surgery and allied subject, I mean to say surgery, anesthesia, orthopedics, and radiology also comes here. And of course, the anatomy and relevant pre and para clinical subjects can also be combined here. And obstetrics and gynecology, along with radiology and anesthesia, can be seen in paper 3. All these for 120 questions will be there for 3 hours. So 120 MCQs has to be attempted in 180 minutes. Next, in the afternoon sessions, we have respective minor subjects like pediatrics, ENT, and ophthalmology for 60 MCQs each for 1.5 hours. So 60 MCQs in 90 minutes. So the MCQs are distributed like into 3 parameters. Like majority of the questions will be clinical based or case based scenarios. They likely problem solving or like analytical skills type. Okay, that will be majority, like 60 to 65% of the questions will be belong to that type. Second is understanding, conceptual or comprehension type of the questions, 25 to 30%, and remaining 10% of the questions will be mostly recall based. But some, it's not hard and fast, but some variations can be expected. But what we have to understand is most of the question will be like typical our USMLE or PLAB exam or recent INICT questions. Like most case scenarios will be given, clinical cases, case-based questions. We have to analyze them, and some interpretation of the values or some investigations may be there. With that, we have to answer. So again, there will be in recent CBME, as you know, there are different levels of knowledge acquisition. So in that, there are 60 to 70% of the questions we are must know. See, for example, being in India, there are some topics which we must know, like in tuberculosis, diabetes mellitus. If you don't know these topics, we may be not good enough. So even the NMC or any authority for that matter expects any students to know some basic knowledge about the most prevalent ones. So these are the must know. From them, 60% of the questions will be asked. There are some things which are nice to know. Okay, so there will be 30% of them, and there are some newer like recent advances or some complicated things, which are some rare things, some syndromes which you may know. It's well and good. So such kind of questions, about 10% of the questions may be there. So let's, if I just tell the pattern, we will not understand. So let's consider some examples here. So to know how problem solving or problem based, case based questions can be framed. Like Shiva, are you there to answer this?
Yes, sir.
Okay, just look into the question here.
Question is a third year MBBS student is
Okay.
rushed to the emergency department after a
Okay.
suspected overdose while attempting suicide by taking an unknown quantity of a medication. So we don't know. Okay. On examination, the blood pressure is 90 by 60 mmHg, heart rate is 45 per minute, respiratory rate is 12 per minute, and oxygen saturation is 98% on room air. So there's BP is low, heart rate is low. Okay.
Yes.
Decreased level of consciousness, cold extremities, and a faint heart sound. Okay. A laboratory analysis revealed blood glucose level of 80. That's okay. A potassium level of 5.2 and a prolonged QT interval of on ECG. All right. What is likely the diagnosis? So a lengthy question. So they've given the ECG, sir. So I can see the QT interval prolonged also. It's definitely not hyperkalemia because the potassium levels are okay. Acetaminophen toxicity possible, but that they should have given another history of any liver damage or anything like that. It cannot be DK because the blood glucose level is 80. So by deletion method, I want to go with beta blocker overdose. And again, what is supporting for beta blocker overdoses? The heart rate is very low, and there is just faint heart sound present with prolonged QT interval. So I want to go with option A, beta blocker overdose.
Excellent, excellent. Very good. This is the way also. See, he has not only answered correctly, but also showed us how to answer also. That's the best way. By rule of exclusion, I also follow this only. So rule of exclusion. See, you're so much like very sure and confirmed now. You have ruled out all the other possibilities and have arrived at the conclusion. So that's one of the best ways of solving any MCQs. You will not have any confusion or dilemma later on. So excellent. So this is analytical type. You have to analyze, interpret some investigations, analyze the things and answer. Excellent. Yeah, and you have to keep time also in mind. Okay, you will get how much per question? Around 1.5 minutes.
Yes, sir. Around 90 seconds, sir.
So within that, you have to answer this. So second type is we have a comprehension type. Comprehension type of question where you have to understand if you understand or comprehend the concept, only then you can answer, not otherwise. So can you please try this?
So the question is, a 60-year-old male is brought to emergency department in a cardiac arrest. Okay, it's established. Despite immediate initiation of CPR, the patient remains unresponsive and pulseless. Okay. The defib pads are quickly placed and a shockable rhythm is identified. Okay. One defibrillator attempt is performed, but there is no return of ROSC. All right. What is the next appropriate step in management for this patient? Okay, next appropriate. So as soon as I read the question, my mind is going that we just stop the shock and go to CPR, sir. That's what we do in emergency departments. We go. I want to search the answer if it's there. First option is administer epinephrine IV. No. We can do it, but if there is yes. Second option, continue CPR with uninterrupted chest compressions. I want to go with that option, but I'll read the other options. Personalized synchronized cardioversion not required because we have already shocked. Administer amiodarone, no, sir. So I want to go with B because that was the most appropriate answer I got in my head right after reading the question. And I would request all the friends out there to read the questions very carefully or even 2 times maybe for that matter. Here the question is, what is the next appropriate step in management? Okay, so this is just a simple example. They can twist it like however they want. Best step in management. What is the best treatment? What is the immediate next treatment? So please go through that because all the 4 answers seem to be correct. In that, which is more relevant to the scenario that has to be picked up. So please read the questions. And how can you improve your reflex, Dr. Shiva? What's your advice? You have already written the exam and you have got a very good rank. Yes, how can you improve your reflexes of reading a question? See, you are already almost finished the entire question and answer within 30 seconds. So how can you do that? Sir, first thing is it comes by practice. So while practice only, you should identify what are the important points and keep it aside. Will it help me or will it not help me? For example, in this question, when I saw CPR, I thought, okay, I should check for pulse. Then I read the question, there was already pulse. So that is sorted. Next, then I thought, okay, pulse is not there. I'll go for shock. They also told that there is shock. Then I again check for ROSC. It's already given. So whatever is appropriate, go for it. Then I try to go from the retrospectively, sir. They've asked me what is the next appropriate step. So retrospectively speaking, they've just given the shock and they've asked for ROSC. So the best part is to look for the clues and identify what are the distractors. Here they're trying to distract me with telling there is no ROSC and there is a shockable rhythm identified after the shock is given. So before the shock is given. So we should identify two things. One, what is the clue towards the answer, and what are the distractors? So if we can identify this one, so the coming to answer will be easier, sir. If we can identify
And,
those 2 points.
to do all those things, don't worry. He's telling so many things how to do that. No, nothing to worry at all. Only one thing you need to do. That is practice, practice, and one more is
Read
practice.
the question again.
Practice.
Yes, True, sir. That's
Okay.
the great advice. Practice, practice, and practice. True, sir.
Solve as many MCQs as possible. I keep on telling my interns or whomever they're around, don't waste your time. If you're in the hospital, fine. If you're traveling, whatever you're doing, your mobile is anyway there in your hand. And so many questions, online questions where it is available. Keep solving MCQs. It's not for knowledge or immediate. You don't think this exam, the MCQ is going to come in the exam. No, not for that. This solving an MCQ is an art. You can't do it in a overnight period, or you may think I'll read everything and directly go and write an exam. No, that's not possible. This is an art. You have to master it over a period of time. So only by solving thousands of MCQs only you can master it a bit. So keep solving when you're not for knowledge for sure, but to gain confidence and to master this art of solving the different types of MCQs. So one more last example we have to what kind of questions can be framed for recall based. Even that can be twisted. Even the recall need not be like a simple one-liner like earlier in the NEET PG, what we had. Need not be always single liner. That can also be problem like case based or simple questions like this. Just go through this, Shiva, quickly.
So the question is: a 40-year-old man presented to the emergency department with chest pain, sweating, and discomfort. Okay. There is a history of chronic bronchitis and sinusitis. No history of any skeletal deformities. I guess that's a typo. ECG was performed and it revealed the following. Okay, the ECG is there. Okay. His wife says that they have been trying to have a baby since a decade with no results. There's X-ray also. There's dextrocardia. I can see the dextrocardia in the X-ray. The triad of symptoms constitutes which syndrome to the patient? There's chronic bronchitis, sinusitis, and there's dextrocardia. So I would like to go with it's not Brugada syndrome, definitely. Holtaram, I've heard it somewhere very back of my mind, but it is a very direct composition. It's fitting directly into the Cartagenous syndrome triad,
Yes.
and then it's associated with infertility. So I want to go with option C, Cartagenous.
Yes, syndromes and all you cannot rule out. See, this is what in analytical you can rule out and this thing answer and all. But here, if you know, you can answer. These syndromes, you can no way you can analyze or rule out. And if you know, you can answer. That's why it's called recall type or memory based questions. So please.
Actually, I want to add, recently in one of the entrances which I wrote, this was a direct one-liner. They directly told that the triad and then they got what is this? So this is twisted with images and ECG. So
yes,
take time.
You have to be ready for anything and everything. So timetable of the typical next exam will be like this. Okay, next one will be in the morning session. We'll have a medicine and paper one, that is medicine and allied subjects for I told like 120 questions for 180 minutes. After that, you will have a 2 hours break, and in the afternoon session you will have pediatrics, minor subjects, that is pediatrics, 60 questions for 90 minutes. Okay, on the second day you'll have complete rest to revise things and refresh a bit. On third day you'll have surgery and allied subjects again for 3 hours, and then 2 hours break. In the afternoon session you will have ENT for 90 minutes. On the third set, you will have obstetrics and gynecology followed by ophthalmology. And just remember, each paper, they have particularly mentioned about this, will be given 10% of weightage with pre and paraclinical subjects. Like in the sense they can have integrated clinical anatomy, clinical physiology, or alcoholic has come with this thing. It's not like he's having polyuria. Which enzyme is deficient here? Okay, so that kind of biochemistry and medicine can also be combined together. So that kind of integrated questions can be there. And 10% nowadays, this thing, forensic medicine also and community medicine also brought into mainstream now. So that can be also be asked. 10% is weightage is exclusively given for community medicine now, and even the forensic can be clubbed along with the pre and paraclinical subjects. So coming to the next two pattern. In the next two, you will have it's a purely practical based examination conducted by the respective universities. Okay, and see here the beauty is you will have only two options. you can either pass or fail depending on your performance. You can either be passed if they find you are good enough or well equipped with the skills, practical skills, then they can pass you. If not, they want you to learn more or get trained more, means they may fail you. So there is no scores. Your friend has got 60, you have got 55. No, so either pass or fail. And only if you pass, you are eligible for the PG counseling. This next 2 is applicable for 2019 and onwards batches. Okay, so the pattern will be like in the practical examination, you have either direct cases, clinical cases can be there kept for examination, or there can be this OSCE type, and also there could be, nowadays in all the colleges we have simulators. Okay, all the simulators there. So using that also, they can ask you to perform some maneuvers or some catheterization or raised tube insertion or any other procedures for that matter. So now a typical picture is like this, Shiva. First, they have to write next one examination. That is MCQ based examination they have to write. Immediately followed by that will be, they'll have their usual university practical examination for final years. Okay, only the final year subjects. What are you routinely we used to have, no, that OBG, medicine, surgery, orthopedics, whatever they used to have practical examination, that they will have. And once the results are announced, if they passed in both, they'll be qualified for the internship. Okay, if they failed in any one, they have to repeat the same thing. Once they into internship, they after completing the internship, at the end of the internship, they'll have next 2, that is purely practical. Now you may ask me one question. Okay, what's that obvious one? Anyone the same question will be going through the mind. That is why you have to write 2 examinations, 2 practical examinations. One is before, one after. The simple answer is that this one, that university practical examination, just to check your competency to enter into internship, whether you know the proper examination procedure, examination steps or not, how to differentiate between a hernia and hydrocele or not, whether you know to, if you are in a casualty, posted in casualty, whether you know to distinguish between a pneumothorax and hemothorax or not, to just check your basic knowledge or the examination methods also. You are conducting university practicals. Once we find that yes, you are good enough, you have adequate knowledge, and you can be eligible to work in a casualty or a ward. Once they find that, then you can do the internship. And at the internship, through 1 year, you'll have a rigorous training. Correct? You'll be going through the different branches or different the departments there, and you'll have a lot of training there. And at the end of the training, they'll assess you whether you are adequately equipped with the basic skills to, for example, as a final year graduate, you know that yes, if there's a clean wound, you need to suture that much you know. But in the internship, you will be literally suturing the wound and learning it practically. So in during your next 2, they may ask you to perform a basic like interrupted suture maybe, or they may ask you to put a male catheterization, or they may ask you to do thoracocentesis. Understood? That's the difference between a university practical examination that is conducted before the internship and after the internship. Okay, and if you pass that next 2, and you will be qualified for PG counseling. If not, need not worry at all. You can get trained for 3 more months and attend the next 2 supplementary examination. Okay, and only then if you pass both, then you are eligible for a PG counseling. And next, in the next 2, we have again 8 subjects, 7 subjects here. 7 subjects. One addition to that, the previous next one is here, orthopedics and PMR, physical medicine and rehabilitation, is made into a separate subject here. So medicine and allied subjects, surgery and allied subjects, OBG, pediatrics, ENT, ophthalmology, and orthopedics and PMR will be there for the this thing in the next 2. Yes, if you have passed both next 1 and next 2, what next? That is, you are eligible directly. You are eligible with your scores. What you secured in the next one, you are directly eligible for. You need not have to struggle for 1 more year preparing for entrance exam and write again. You may qualify or may not. Again, this is again goes on. Okay, the cycle. So all these have been now cancelled. Now you're directly eligible for PGA counseling. Counseling will be again conducted twice a year, once in June and once in December. And the sessions, respective sessions, will start on July 1st and January 1st. And next one's course will be considered. Each like once you have got a score in the next one, that will be valid or considered for 3 years. This will start from batch 2019 batch onwards. If you have scored little less and you are not eligible for the desired branch, then definitely you can write the exam again. Okay, next exam you can keep on. No, there is no limit for any number of attempts. Okay, you can write it n number of times and better your scores every time. And there was a confusion here created, that is what is the way to consider the scores? Like if I have written the 3 exams, whether the average of this will be taken or the best score will be considered. So official, like in the 2022, whatever they had told us, that is average of the 3 or the what, if you have written 2 exams, average of that will be taken. But now this 2022 official notice has been taken back. Now they may come up with a maybe a new notice about this. Still it's not clear, but according to me, I feel best score has to be considered, just like what we have in the USMLE and all. One best score, like a recent one, the best score has to be considered. That's the best way. What do you feel, Dr. Shiva?
Yes, sir, absolutely. Because taking average of 3, that is, I got a lot of DMs regarding that too. So it was so amazing that you noticed it and you took it upon yourself to clarify it. That if they take three scores, if we mess up one by mistake or something, the 3 next sessions will go down. So thank you so much for that clarity.
So what about the previous batches, the seniors, those who are still like not got the PG seat? For them, there is still hope is there. Okay, still hope is there, but you need to be a little more aggressive on your preparation. That's it. If you do that, you can again need not go through all this NExT and all. That is, in the November there is one INA seat is coming up. Okay, and again in May also AIMS will definitely conduct, because they want residents at any cost. Okay, they will not listen to any others. This AIMS is much superior to the NMC or anything. Okay, even Supreme Court has told that no. That is what I said for MCH entrance exam. I still remember when I went into AIMS exam, MCH entrance exam. There is Supreme Court order that there is no interview should not be conducted. Even then, AIMS conducts that. All the others have stopped. PGS stopped. Sri Chitra has stopped. All the other institutes have stopped. AIMS is still continuing to do that, because they want only interested and the best ones. They don't want those who just cleared for the sake of an MCH degree. So AIMS is a special body altogether. So they'll make sure that they'll conduct 2 exams for themselves. So still those who are not got into this NExT and all, CBME, they can attempt this INA CET in November and May. And also there will be one NEET PG in 2024 also as a last option for them. You can definitely, most of you will clear through this, and you need not have to worry about this NExT and all. Okay, if you clear that. If you're not, then if you're not cleared in these 2 attempts, then like usual you have to write next one with others. From May 2024 onwards, you have to write next one, but you need not take next 2, because you already completed the internship and you have passed. You need not have to take next 2, but for the PG rank, you have to get a score in next 1. For PG counseling in 2024, that is NEET PG or the INACT, the respective scores will be considered. For 2025 PG counseling, again, there is only one option, that is next 1 again. So one good thing is that yesterday only we got a notification by AIMS Delhi. Today it's been circulating everywhere. That is, AIMS is going to conduct a mock test for all the final year students, those who are interested to know more about what the exam pattern will be like, how to attempt and how to prepare and other things. I feel, I also request all my students out there to take it seriously, not on your preparation, but to strategize yourself. Please don't think that this is a common mistake what we all do as a student. oh, I have not prepared, I don't know anything, my final year is all the subjects are still not covered, how can I write an exam, what if I get low marks, lot of unnecessary anxiety and tension. No, this everyone knows that your final year subjects are not covered and you still not read most of the things. Everyone knows that. Even then, if they are conducting an exam, that only means that this is for your preparation starting. Okay, just in the beginning of your preparation, if you know the pattern, how is the questions like, then you can prepare accordingly. So just attempt it, irrespective of your preparation level of preparation. Just go and on July 28th and attempt the examination. You will realize what kind of questions they'll ask, how they twist, and what kind of case scenarios, on what topics they'll stress more. Which area I'm a bit weak in, where I have to stress more. Okay, which subject I have to give more importance to. All the things you will realize for yourself. Okay, you need not have to listen to various videos, various motivational, inspiring videos, strategy videos. No, you can make your own strategies by just attempting, by just spending one day. That is on July 28th, by attempting this mock exam. This is definitely going to be a very turning point for all the next aspirants. So please, it's a one day. In 2 sessions will be there, purely online, and the marking systems also just like the upcoming NExT exam, that is +1 for correct answers. So you can get as maximum as 540 marks. Shiva, am I right? You can score 540 marks. Wow.
Yes, sir. 540. That's
yes.
Amazing.
You can aim for that. Aim for 540 and you will get it. Okay. And in case if you make any small errors, only 0.25 will be deducted. Okay. So mock exam, again, in the morning, there will be paper 1 for 3 hours, consisting of 120 questions. And in the afternoon session, it will be for 3.5 hours for 140 questions. In the morning, you will have mainly medical and allied branches like ophthalmology, pediatrics, etc. And in the afternoon session, when you are very sleepy, you will be energized by the surgical questions. It's like just surgical strike. Okay, you have to be awake and aware what's happening around. So surgery and OBG, again, very interesting. ENT and other relevant allied subjects will be asked. And both will be MCQ based, 1 mark each for right answers and 0.25 negatives. And if you kept the question for review, or if you are not answered, means there will be no negative marking also, or there will be no positive also. It will carry 0 marks. So at the end, the only thing what I would like to request or stress more upon to my friend, all dear students, is if you think you can do it, then definitely you can. It's all here. Okay, it's all. If you see, I always tell my Vitamin members, you conceive an idea. Okay, that today only, right after this session, you conceive that yes, you are going to be the best in the NExT. You are going to the best in the upcoming NExT. You have conceived an idea. When you conceive such an idea, no, automatically your actions, or you get such a power to go through it. You will get you have to believe in that. Conceive an idea and believe, yes, I'm going to the best. I'm going to the best in NExT. I'm going to the best in NExT. When you believe that, and automatically your actions, thought process, hormonal release, everything happens accordingly, and definitely you're going to achieve that. That's the ABC of life. For anything, to achieve anything, you have to first conceive that idea, what you are going to do, how you are going to do, and more than everything, you have to believe that, yes, Kishan, if Kishan has done that, means I can also do that. That's the belief you should have. Okay, Shiva, you want to add something there? Yeah. You are a very good motivation speaker too.
No, sir. That's amazing, sir. That you are just your enthusiasm, even through the screen, I can feel that enthusiasm, and I'm jealous that I too am not I have the motivation to do the exam now. I need not write it, so I'm going to carry forward to the students this. That's really inspiring.
Yeah, there are some people are asking whether the same what's it on YouTube? Someone has asked. There's the same thing will be implemented for PG courses as well. Yes, definitely. Okay. Now it's already the second batch of CBME for post-graduation has come up. Now this is into second batch. So even the PGs will also have similar for their examination also, for sure. Okay. So during your post-graduation, okay, at St. John's, maybe wherever you are going to, okay, hope you get the best. And there you will have, again, you can do all those things. Okay. Don't worry. If you are interested, you will definitely get all the opportunities are wide open, and they'll take you to success. So any questions you can ask now, any common questions are there?
Actually,
Shiva will ask on behalf of the members, and other members also can put it in the chat section, comment section, and I'll also directly go through if there are questions in YouTube.
Yes, sir.
Thank you so much for the listening to the presentation. Thank you.
Sir, first I would like to tell on behalf of all the aspirants and myself, since I have a younger brother who's going into he is in 2019 batch. It was really amazing. You literally micro dissected the meeting, micro dissected the YouTube videos, micro dissected the notification given by NMC, held our hands and walked through the steps. Thank you so much. With so calmness and so calmly you explained whatever was taught. Thank you so much, sir. On behalf of all aspirants.
Everyone can do this, okay, but the students are just mind blocked. They're mind blocked, like with what, like unnecessary anxiety or commotion being created out there. So we, as a senior or as a teacher, it's my duty to help them to come out of this, and they'll definitely do well once they just come out of this. And what my only request is, don't heed to any rumors out there. Don't even zero time. You should have zero tolerance or zero time for any rumors or negativity around. Don't waste a single minute listening to or watching to others. Instead, spend maximum time on studying, preparing. Okay, studying, irrespective of the what may be the pattern, when is the exam. What's the only thing which is constant is your syllabus. That will remain. They can't ask question from economics or sociology or geography. They have to ask the question from your surgery, OBG or pediatrics. So keep studying. No, again, surgery can't be changed. For AIMS exam, separate surgery. For PLAB, there is separate surgery. Nothing like that. Same surgery will be asked in any medical examination. So keep studying that. Why you're wasting time? Okay, don't wait for anyone to help you with surgery, or don't wait for someone to get you through. Keep reading your books and keep preparing. Don't let even, because later on you will repent. Oh, during that 1 week where everything was happening, changing, I should have utilized my time for preparing instead of listening to these rumors. That time should not come. That repentance should not be there. So how can you elevate that kind of repentancies? By keep preparing, keep studying, even during this very hard time also, whatever you're going through. 2019 batch, I can understand, very well understand. It's telling is easy, but going through that is very difficult. I understand, very much empathetic to you all. But having said that, what I, as a senior, I can just tell you, request you is that, please, this time will also pass. Just like COVID passed, just like GST passed, everything passed. That small confusion also will go away. But what is one thing constant is your hard work and maintaining your confidence levels. Only two things are constant, and that will take you to success. So never ever get upset by what others says, what the pattern is like, why suddenly it happened to us. We don't have any time remaining now, only 4 months. No, those things are not in our hands. That cannot be changed by getting tensed about that. Can you change the things? No, it has been already decided and implemented. You cannot change. Whatever they in your hands, then you can worry about that. Which is not there in your hands. What's the need to worry?
Yeah, that's true, sir.
No. Shiva has worried so much about that. So let's change that pattern of questions. Will they do that?
No, sir.
No, they will not. So just get adapted. That I understand. First batch is always difficult. You will not have any clue what's going. But I'm very much sure they'll keep it very simple and student friendly. That's for sure. They'll make it very, and if there are any discrepancies from their side, they'll definitely do it as friendly as possible to the students. So if any questions are there, we can take up. Shiva, do you have any questions?
Yes, sir. So I've been getting a few DMs for some time now. So I'll go one by one. The first question is, will third year professional exam, that is ENT, Optal and PSM, be stopped just like final year?
No. This is clear cut. This is only for final year. That is third year, part 2. Only for them, this kind of alternative MCQ instead of theory is there. But third year ENT, that will continue like before. No change in that.
Thank you. Next question is, sir, will they split the PG seats? You told there were two PG seats. So will they take, for example, there is for I am interested in emergency medicine. So if they want to do, there will be 4 seats in one institution. So will they give 2 to May and 2 to June, like
No,
AIMS and?
Unlikely this time they will not. During May counseling, normal counseling, they will do the full counseling, okay, normal. But in the second counseling, for now, they may go with the remaining seats, whatever the unfilled seats are there. Second thing is INA-CT, they'll always have this, like colleges like AIMS and all, they always have like two sessions, right? That will be continued, and remaining seats can be taken up during November session. But having said that, we all know that the seats have been increasing day by day like anything. PG seats. In my time, 2,000 was the cutoff for surgery. Now it has come up to 12,000, 13,000. That means that so much of seats have been increased. So nothing to worry. There will be one day soon where there will be equal number of UG seats and PG seats. Okay.
That's
so
the dream. Yes, sir. That would be ideal.
So, yeah,
yes,
once that time comes now, that once enough PG seats have increased, then they'll definitely split. That may take 2-3 years of time, but till then it will not be equal. That whatever the remaining seats are there, or the extra seats during the even in PGA also they do the same thing. What are in the second session of the year, what are the remaining seats are there, what are the extra seats? If the going out batch has six people are there, means they'll include 6 seats for this session. Like that, they will adjust it, try to adjust and accommodate.
So it will be dynamic in the
yes, absolutely.
Sir, one more question is, what if I fail one subject and pass the remaining 5? What will happen to them?
That's very much clear. It's made clear. Okay, you need not have to write all the subjects again. Whichever the particular subjects you have failed in, that paper has to be repeated, and the scores of the previously all the past subjects, like in the first test, if you have passed 5 subjects, that raw scores of those 5 subjects, and in the supply exam, that one subject whatever was remaining you passed, that score will be combined and given the rank or the total scores. Clear? Is it clear?
Yes, sir. Yes, sir. So one subject goes means I'll write that exam, only that score will be taken, combined with the 5 and
added. Perfect. Perfect.
One last question. It's a very specific question, sir. What about RS2, RS3 repeaters who are waiting for their final year exam conducted by RGUHS? So will they write university exam, or will they have to merge with NExT, sir?
Yes, this is again a very difficult one. Okay, they have been recently also we saw university, they are so kind and considerate. Even after like they had initially announced there will be 4 attempts, but even after 4 attempts were over, so for some students they gave the 5th one. Okay, they told, you take one more chance and try to finish, like pass it. So always our professors or the seniors are so much considerate about the students, and they'll always try to help us. So for here also, they will definitely give us 1 or 2 attempts. For university, will give us definitely 1 or 2 attempts to clear with this. If we even after 2 years, if we can't, then they may have definitely merge with the this thing. They'll merge with
just like they merged RS1 with RS2 and RS2 with RS3. So similar process will happen with RS3 and RS.
Yes.
Sir, on behalf of all the aspirants, there are some more questions in the chat box. I just want to add, to the benefit of everybody listening, that from yesterday, from the point the NMC webinar has happened, I'm constantly on YouTube and Twitter. I'm following every single tweet in MedTwitter, #MedTwitter, and on YouTube. I would like to say thank you so much, because it's the first conversation I've come through that is entirely positive, looking at the positive aspects, giving positive reinforcement and useful information without any commercial benefits from it, sir. So thank you so much, sir, for being our elder brother like always and helping us out. So I'll go to the questions in the chat box, sir. So the first question is how to start studying. It's a vague question, but for 2019 batch people, they're in chaos. They're not able to start. That starting trouble is there. So how do you suggest they start that question, the study?
You please answer that. You are better because you are recently completed and you know the strategies better than me, and you are successful also in your like this thing strategy. Please you please share the strategy.
You, sir. So I want to share the strategy that I personally have been devising for my younger brother. So it's very personal for me. So right now it's raw, but what I suggest you guys to do it is, start studying today. What sir told, you have accepted, you have believed. Stop going on Twitter, YouTube, seeing more videos about NExT is not going to change
Not
that.
change anything. Yeah.
Stop seeing all the YouTube, all Twitter, everything. Stop today, uninstall or do whatever. But stop going again, trending on Twitter. Cancel NExT. That's not going to happen. They're not going to listen to Twitter trends and cancel. So first advice is start today. Start today. How do you start? Is you
Start
find
now.
one source.
Start
Start
now.
now. Start now.
Right now.
So you believe one source. It might be your standard textbooks, or it might be your coaching app notes, or it might be the notes you've already done in your third year and second year. So trust that one source and practice MCQs every single day. Every single day. Start with your core subjects, that is medicine, surgery, and OBG, pediatrics. That is the core subjects. And whenever you come through a point, for example, in medicine, you're reading liver cirrhosis, and suddenly they say, right lobe of the liver has this blood supply. So go back to anatomy at that point and read the anatomy of liver and physiology of liver and come back to it. And sir gave a very beautiful example, because when this NExT was announced, my brother came in and told, Abba, biochemistry illa appa samadhana aitu nange. So I would like to add what sir also added, that biochemistry questions will be integrated with clinical. So when you're reading pediatrics, the enzymes, everything, go back to biochemistry and read the cycles. So start integrating, don't go in one dimensional, and start with your basic subjects, that is medicine, surgery, OBG, and pediatrics. Then as you go forwards, when you're reading surgery, hernia, go and read the abdomen and anatomy of what is associated with hernia. When you're reading varicose, go and read that. So I suggest you start with your final subjects and start integrating parallelly, because CBME batch, you guys are used to stepwise learning. So that's my advice, sir.
Nothing to worry. Absolutely, there is nothing to worry at all. Because only, see, even if you miss out that first year and second year topics, how much you are going to miss? 10%? Majority, 90% of the questions will be from your core final year topics only, third year and fourth year. So if you just third year anyway, you are fresh, you're not forgotten much, okay? And final year anyway studying from the beginning, okay, of the year. So don't worry about now. They'll create a lot of confusion. So many people will be there. Do system wise, do this wise, that wise. No, do strategies for yourself and do your own. Practice your own, okay? Don't listen to anyone about this. But what I say is, stick on to the final year subjects, read them well, because 60 to 70% of the, again, in that also, when you are reading about the hernia, the anatomy will come anyway. In the beginning, any book will initially give the anatomy, and then only they'll go to the pathology or whatever it is. So in that hernia surgery book only, anatomy will be covered, relevant physiology, pathology, everything will be covered. So if you read one book, that is enough. Even for medicine also, nobody will directly take you to the clinical features of pneumonia. Okay, they'll first tell the relevant physiology, then the pathology, like that. Pharmacology, everything is included in those books. More than enough. Medicine is nothing but what? 3 P's. What is medicine? It's nothing but 3 P's. Physiology, pathology, pharmacology. Okay. Surgery is nothing but altered anatomy.
True, sir.
Okay, so they are not some special subjects or some different subjects. They are the combination of whatever we learned in pre and para clinical subjects. Okay, so don't worry at all that you have to, in 4 months you have to study again the first year subjects, second year subjects. No, stick on to your final year books and read them, and just glance or just revise once through your third year subjects, that is ENT, community medicine, and the ophthalmology. Okay, that's more than sufficient. And strategies are like, most probably, yes, one thing where again I feel it's nowhere it would have mentioned. So many messages, everything I got, nowhere it's mentioned, but we are going to reveal it for the first time. That is, most probably 2019 batch will have their NExT exam during January, not November nor May. This time, for this particular time batch only, they may adjust it. This is not told by me. Okay, this was told by NMC chairman himself during the meet. This time the exam may be adjusted for 2 months, like extra will be given to you, and maybe conduct like your final year exam also would have been there during the same time. Okay. So you will get enough time to prepare, enough study. But having said that, you be prepared for November. If you're prepared means, then if it's postponed to January, you will get 2 more months extra time where you can breathe in freely and prepare, revise again and again. Okay, you need not think that, oh, it's in January, let me start preparation in December. No, that should not be your strategy. You prepare for November. Have a short-term goal, prepare for it. Then once it's announced that it's in January, then you will get, oh my God, it's a big, big breather. So that's the one thing we have to note here. This was not officially announced anywhere. Still, there is a dilemma that whether it's November will be the first exam or the May. They will not again waste your time, of your course. They will not extend your course till May or so. I don't think so. Even if they extend to May, it's good only. I feel it's good only. They get enough time to study seriously, and they can give the best attempt for their entrance exam as well as licentiate exam.
Thank you, sir, because that was a very important point. Exactly when the university exam was scheduled, they might have the first NExT. So they can just not panic too much and just focus on learning and give the exam at the exact same point. Sir, one more suggestion on one of the groups I saw. It's a very beautiful analogy. Just like in NEET UG, 90 questions is from biology, 45 is from physics, 45 is from chemistry. So focus so much on biology because easy to score if you can get 90 questions right. Similarly here, ENT, Opthal, Pediatrics and OBG, they carry 300 marks. That is 300 questions, more than half. And it is not very hard to master these subjects, ENT, Opthal, Peds and OBG. So we can master this first and then move on to medicine, surgery, like physics and chemistry.
Good,
go. That's a suggestion that I saw was
good suggestion. Good one. Easy ones and where you can really score well, that you finish off first. And see, medicine and every day you are studying anyway, and you attend the clinics and also you can answer it. Okay, but with some volatile subjects which you tend to forget and easily scoring still, that you can finish off first. Any other questions from your side or from the chats? There are some questions in the YouTube. I'm checking.
What exactly does allied subjects mean? They're asking.
Yeah, that I already answered. To that. Okay, again, let's you have to understand. Medicine and allied science means already medicine along with the psychiatry. In the medicine paper, what all the questions will be asked in your medicine paper? There will be some 1 or 2 questions on psychiatry, 1 or 2 questions from dermatology. Okay, there will be some physiology, like then pre and para. That can be anything. All the pre-para can be combined, but main allied subjects are the psychiatry, dermatology, and maybe a bit of the radiology as well. Some X-ray, all those things can be kept.
Yes, sir.
And surgery. Surgery is allied with anesthesia, orthopedics, and radiology. And pre and para always there. Clear?
Yes, sir. So there's one last question here in chat box, sir. How to get practice question in NExT pattern?
Yes. See, NExT pattern, it's nothing different. I again told you. Again, just like your INACET pattern or USMLE pattern, more of case-based. It's already for CBME batch. This has been the norm since the first year MBBS. They have been getting, even you had the MCQs in your final exams, 10 MCQs were there. Most of the case-based only. Even for long essays also, they used to ask case-based questions only nowadays. That's been the norm now. So don't have to refer to any, I don't feel any necessity for any new resources. Whatever the existing resources are there, more than enough to study or prepare. But you need to give some mock tests as well. Mock exams you have to write. Using a CBT, that is computer-based test only you have to give, because reading is something, but when you on the exam day, sitting in front of a computer for 3 hours, focused, fully alert, that's something different that you need to practice. As a medical students, we are not used for computer or laptop, long sitting in front of the computers. We are not used for it. That you have to practice. So whenever possible, write as many mock tests as possible. I make sure that in White Army also, I'll try to conduct as many mock tests for free, as many mock tests as possible. So keep trying them also. That's how we can master ourselves.
So to summarize what you have told, just for the benefit if they want to see the end of the video, sir, you told us that we should first accept that it is happening, not have any confusion, believe that we can do it and jump into it. And to summarize your entire talk into 3 words, that is practice, practice, and practice.
And practice.
Practice. Thank you so much, sir. If there are any questions, we can go ahead on YouTube. Yes, I agree with Hridayda.
Someone's telling passing 50% with negative marking is so difficult. I agree with you, Mr. Lokesh, because yes, unlike our old pattern, that is theory, there the margin for passing is more. If you are considerate or a very liberal examiner like me, if he comes, if you just code 45, I can pass you that with 50. But here you have to pass on your own. I can't pass you, or your friend cannot pass you, or in matter of influence can pass you. Only thing can pass you is your hard work. Yeah, that is there, and it's a fair also. It's a fair play. Those who have studied hard only will get through, not the others. Okay, so a bit difficult to pass in MCQs when compared to the theory. But the beauty of MCQs, I always love solving MCQs, because answer is right in front of you. For a fellow like me, who has got very short time memory, I can't remember anything.
I remember your quote
I can't
back
remember
in
big topics and write the same, reciprocate the same in my examination. Very short memory. But I love MCQs because I need not remember. The answer is right in front of me. When I see that, yes, this is the answer, and I have my own ways to solve them. I am very happy with the MCQs. Although it's difficult to pass, but it's a better way of writing an exam, I feel.
Because I remember in COVID, you had told in theory exams, the answer is kilometers away. In MCQs exam, the answer is centimeters away. That's the advantage.
And Vishnuvardhan is asking, reduce duration of exam to 1 day. Is it required?
Sir, actually, I feel since I've written NEET PG exam and I've seen my friends write NEET PG exam, 1 day is more like a T20 game. On that day, if you are in form, your entire preparation might go forward or might go backward. It doesn't matter. But this is more like test. Your persistence, your consistency, and you get more chances to make a comeback. Morning session doesn't go well, it's all right. We'll come back and do the afternoon session well. Day 1 doesn't go well, we'll come back and do day 2 better. Day 2 doesn't go well, we'll come back and do day 3 better. So there are more chances for comeback, more chances to, believe in ourselves and come back. So again, there's a reason that test cricket is the OG. So I feel this is a very good development, splitting it into 3 days and 6 different sessions.